my name is Pierre. I am a Senior Clinical Director at Flatiron Health, and I'm a nurse practitioner at Memorial Sloan-Kettering in New York, and I'm pleased to talk about my abstract. So my abstract was looking at the impact of structural racism and social determinants of health on FISH testing in patients who have multiple myeloma. So this study focused on a wide array of patients in the United States with the diagnosis of multiple myeloma. We looked at about 14,000 patients, a little under 14,000 patients, and we know that FISH testing is important for diagnostics. It's important for risk stratification, prognostication, and even biomarker-driven therapy, even for clinical trials. So we wanted to see what factors were at play for patients to get this test, considering its standard of care. And we know that there are some health inequities related to social determinants of health. So some factors we looked at structural racism. It was a measure of residential segregation. We also looked to see another variable we looked at is living in a medically underserved area. We looked at urbanicity. We also looked at language proficiency, the percentage of patients in a neighborhood that had a limited English proficiency. We also looked at vehicle ownership. So these were all area level variables we looked at. And what we found was there was actually quite a strong relationship between the language proficiency variable and the vehicle ownership variable. So we found that patients that lived in neighborhoods with the highest amount of limited English proficiency were the least likely to get a FISH test. And this is at any point during their disease trajectory from diagnosis all the way up until last data cutoff. And for vehicle ownership, there was a gradient relationship. So pretty much with each amount of less percentage vehicle ownership of areas, we saw that patients who had the highest area of low vehicle ownership were least likely to get a FISH test. So this is telling us that there are language barriers at play here, and there's also transportation barriers at play here to receive standard of care testing. And so resources need to be put in place to address these barriers so that patients are able to get the proper risk stratification that they need, prognostication, and this could also play in potential for eligibility for biomarker-driven clinical trials. And we need to see equity there as well. So I think the importance of this abstract is just driving home that social determinants of health really can affect access to standard of care measures, and policies need to be put in place to support those patients to decrease inequities. And I think some actionable things we can do with the results of the study is make sure we're screening for social determinants of health in our practices. You know, upon diagnosis, asking questions of patients so we can find some of the gaps and holes for of care to supplement their care. And so to make sure that they have the ability to get to the cancer center. They have the ability to get the testing that they need. There's full understanding in terms of language proficiency. So we need to make sure that we have written materials for patients in their native language so that they fully understand the importance of everything we're doing in the cancer center. So I think, if anything, make sure we're properly screening for social determinants of health so we know exactly what we can do to help our patients with access to care.